डायबिटीज लेकर आते हैं टेस्ट रिपोर्ट में अपने लिए, गोलियों दवाइयों के अलावा क्या सुझाव देते हैं?
Most important is weight loss. A big truth that diabetes can be reversed.
आपने तो इतने सारे पेशेंट्स देखे हैं, उनको ठीक भी किया है, तो आप जनरली जो डायबिटीज़ लेकर आते हैं टेस्ट रिपोर्ट में अपने लिए, उनको आप क्या गोलियों दवाइयों के अलावा क्या सुझाव देते हैं?
I have been practicing exclusively diabetes management since last 25 years, perhaps more than that. And what I am going to share with you right now is not textbook knowledge, but what I have experienced practically and personally over all these years during the entire span of my career. And what I feel is, if you want to interfere or intervene in the management or reversal, for that matter, reversal of the diabetes, it is always earlier the better. It depends on the stage at which the diabetes is detected, at the time of diagnosis, the progression of the disease, which matters. But certainly, it is not a myth, it's a big truth that diabetes can be reversed. No doubts about it. Because
Great.
I have...
That's a very, very good news early in the morning today.
And I am speaking this from the scientific perspective. Let me tell you very clearly, it is scientifically proven. A study is being done even at Jaipur among a selected group of patients, where we are studying how to reverse diabetes in a selected group of patients, and the results would be out soon. But then, as I always mentioned, it depends on the stage of the disease. One is a normal person without diabetes. Then the stage is impaired glucose tolerance, IGT, which is a stage between the normal and a full-fledged diabetes. This is the most important stage and the best stage when the diabetes can be reversed back to normal. Either it will go and progress towards frank diabetes, or it will go back and turn into a normal thing. So this is the best time when you can intervene and make the patient or the person again normal from impaired glucose tolerance. The next stage is frank diabetes. Frank diabetes again is type 1 and type 2. Briefly, so let us be very clear. Reversal of diabetes can be done only in type 2 diabetes. Type 2 diabetes is a lifestyle disorder. It is normally occurring after the age of 30 years, 25, 30 years. Type 1 diabetes is a genetic disorder where there is no insulin in the body. So let us be very clear, type 1 patients, type 1 diabetic children have to be on insulin. They cannot be reversed back to normal. There should not be any confusion on this. Only type 2 diabetic patients can be reverted back to normal. The most important is weight loss. If you can, and again the weight loss is two types, pathological and physiological. A diabetic patient who loses weight too much and too fast, that is a pathological weight loss. That indicates your sugar levels are very high. Physiological weight loss means you have to be, a proper strategy has to be followed. Gradual and sustainable weight loss has to be done through diet changes, through lifestyle changes, through so many things, like brisk walking 30 to 45 minutes. That means 4 to 5 kilometers a day. That turns out to be around 10,000 steps a day. That is practical, which I have normally suggest to my patients. Dietary habits. What is more important is not the amount or the type of food. The more important is the calories. Around 800 to 1200 calories for an obese patient. If you can maintain that over a long period of time, that goes a long way to attain the weight loss and then revert back to normal. So these are few important things which we should follow.